So a common body part that you often see tendonitis and bursitis develop in is the shoulder. You often see an onset of rotator cuff tendonitis. The rotator cuff is four small muscles that are responsible for holding the head of the humerus, or the top of the arm bone, into the glenoid fossa, which is forming what we would call the shoulder joint. If there's a compromised integrity to any of those muscles, like a tear, a strain, or just a weakness where another one is strong and the other side is weak, you'll see poor gliding of the humeral head in that glenoid fossa. So what happens is this bone will jam into this bone, and that repetitive movement will start to fray the tendons of the rotator cuff, and then chronic inflammation will occur. Resting between the rotator cuff and this bone here sits a bursa, and you can imagine that if you have poor mechanics in that joint, whether rotator cuff problem is there or not, that repetitive impingement of that bursa will cause a cycle of inflammation as well. You often see tendonitis, rotator cuff tendonitis, and bursitis happening together. Usually what we do in the clinic to address that is first diagnose what's going on, and then find the deficits of what's causing that rotator cuff tendonitis and or bursitis. The main goal in treatment is to improve the mechanics of that glenohumeral joint, or the shoulder joint, so that it's not pinching and impinging when you're reaching overhead or doing repetitive movements at work or at home. So a good way to figure out what's causing your pain is to come into our physical therapy clinic and have a physical therapist diagnose what's going on. And if it is a bursitis or tendonitis, the main goal is to get this joint moving and gliding nicely to remove that mechanical problem of pinching causing inflammation. What we would do, we would tease out where the muscle imbalances are and address those, if any. We would use our hands to work on joint mobility and soft tissue immobility that could be limiting the mechanics of the joint. We would also look at your body mechanics and talk to you about what kind of functional activities you like to participate in, or your work duties, anything that would involve repetitive movements, swimming, golfing, painting. Overhead painters often have problems with bursitis and tendonitis. And we would really just address how your body's moving and making those joints healthy. So if you feel like you're having any of the symptoms of tendonitis or bursitis, click the link below or give us a call here at Loudoun Sports Therapy Center, and we'll have a physical therapist check out your symptoms.